Good evening, all. Sorry for the delay due to some network problem. I couldn't connect. That's why the delay occurred. Good evening, good afternoon, and good morning. This is a 2137th day of uninterrupted webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. JANKI BHANVADIA, MD, PhD homeopathic physician. So this is a very important subject to be discussed. I hope all of you will watch the session, and you can also suggest what are the things to be done in the future if things happens against a homeopathic doctor or a homeopathic community. So we proudly welcome the guest of the day, Dr. JANKI BHANVADIA.
Okay.
Yes, doctor. Sorry
Yes.
for that. Yes, sir, there is some screen sharing.
Okay, is it visible, sir?
Yes, it is visible now.
Okay. Thank you so much, sir. So, very good evening to all of you, and thank you, IFPH. It is my pleasure to be with you, all of us, all of you today. So, myself, Dr. JANKI BHANVADIA, and today's my topic of discussion is from consultation to courtroom, medico-legal mastery for modern homeopathic physicians. So, before we begin the session, I would like to ask one simple question. How many of you think that medical legal cases are only seen in government hospitals or in any emergency departments? Yes, many of us, even many of the students and even the practicing doctors, they often think that we are not surgeons, we don't perform any postmortems, and we don't work in casualty department, and we just simply run our homeopathic OPDs. So therefore, we assume that medical legal cases are not related to us and it is someone else's responsibility. But in reality, the reality is very different. This is the biggest myth about the medical legal cases, that they only seen in the hospitals. But the truth is that these cases frequently work in our day-to-day practice. The problem is that they do not introduce themselves as medical legal cases. They come as an ordinary patient. For example, patient may come with headache, with anxiety, insomnia, with complaint of fever, with complaint of back pain, anxiety, any of these complaints. Okay, but at first scene, what happens? Everything appears as a normal and routine consultation. But sometimes what happens? There is a hidden legal aspect behind every clinical complaint, and if we fail to identify that aspect, we may miss an important responsibility as an healthcare professional. So here, let me give you an example. Imagine 25-year-old patient comes to our clinic. He has swelling on his face, a cut on his lip, and some scratches on his forearm. And we ask him what happened. Then he replies, "Doctor, I slipped and fell." Now, most of the doctors will immediately start thinking about the treatment. Which medicine should I prescribe? Should I give arnica, or should I advise rest, or should I schedule a follow-up? Okay, these questions are important clinically, but medical legally, our doctor asks one more question, that is, does the history match the injury? Okay, this case might be an accidental case, this might be an RTA, this might be a case of physical assault, this might be a workplace injury. We never know. So, every registered medical practitioner has medical legal responsibilities. Uh, in a court of law, it does not ask, are you an allopathic doctor or homeopathic doctor or an Ayurvedic doctor? But law asks us, did you act responsibility as a healthcare professional? Okay, so as a doctor, we are expected to maintain proper records, to obtain the consent from the patient. We are expected to ensure patient safety, recognize emergencies, and we are expected to refer when there is necessary, and we are expected to maintain confidentiality. So these responsibilities apply to all the doctors regardless of the system of medicine they practice. So why this topic is more important in today's era than ever before. See, we all know that since last few years our healthcare sector has changed dramatically. So today's patient are very difficult, very different from the patient that 20 years ago, because nowadays patients are more acquainted with these new age technologies. They are able to search their symptoms on Google. They use the social media. They watch medical related videos on YouTube. They use AI tools. They know their rights, and they ask so many questions. Okay, this is not a bad thing, but it is also mean that doctor need to be more careful, more professional, and more aware of their responsibilities. So clinical skill alone are not enough in today's era. So as a medical student, we have learned so many subjects like anatomy, physio, pathology, materia, repertory, and all the clinical subjects. But very few doctors received adequate training in an equally important area, that is how to protect patient and yourself legally. So many a times many legal problems arise not because of our treatment is wrong, but they may arise because our documentation is poor, consent was not taken, and referral was delayed, and there might be some communication issues. So in many situations, these legal issues may arise. Uh, So the purpose of today's webinar is not to make you afraid of legal issues. It's not about turning doctors into the lawyers, but it is about making doctors more confident and more prepared. So by the end of this session, we will learn how to recognize medical legal situation in daily practice, how to document cases properly, how to make safe referral decisions, and what common medical legal mistakes should be avoided. Okay, so now let's understand why medical legal awareness is necessary. And for that medical legal practice, there are three golden skills that requires that we can say that RRR concept. What is RRR? That is recognize, record, and refer. Okay, so now let's understand the first golden rule of medical legal practice, that is recognize. What does mean to recognize? It means identifying the situation that may have some legal implications. It means understanding that the certain patient require not only medical management but also a special documentation, also observation, reporting, and referral, all of them. Okay, many medical legal cases are missed because doctor focus only on the symptoms and not on the circumstances. Now let's understand this with a case scenario. For example, a 24-year-old college student comes to a clinic and has facial swelling with the bruises on the arm and cut over the lips. And when you ask what happened, he says, "Doctor, I slipped while walking." Okay, it's that simple enough, right? But before accepting this explanation from the patient, we should think critically, we should think twice. Okay, does this injury match the history? Is the explanation is reasonable, or are there any signs of struggling or assault or not? Okay, so as a doctors, we are not investigator, but we are trained observers, and observation is one of the most powerful medical legal skill. So it is very important to observe all the things that we came across in the injury cases. Sometimes what happens, patient may hide history because of fear, embarrassment, or due to any family pressure, any social stigma. So therefore, whenever you encounter an injury cases, just don't focus on treatment. Try to understand the circumstances. Now let's take another example of suppose a 30-year-old woman visit our clinic with complaint of anxiety, sleep disturbances, frequent headaches. And when we examine, we notice bruises on her forearm, and we ask her about that bruises. Then she simply smiles and says, "It's nothing, doctor." So at that point, many of doctors stops asking further questions. But what if those injuries are due to domestic violence? And also, research says that victims of domestic violence often seek medical help before they seek legal help. So we should aware properly. Okay. We should observe the patient by its body language, its emotional state, its interaction with doctor and interaction with relatives, its fearfulness, etc. Okay, now let's take example of another case scenario. For example, a child is brought to your clinic by his or her parents, and parents says, "Doctor, he keeps falling while playing." And while examination, you notice multiple bruises, and there is injuries in different stages of the healing, and injuries at unusual location. So now ask yourself, could this be a simple case of an active child, or there might be in chances of child abuse? Okay, here we are not expected to make judgment, but we are expected to recognize the red flags. So if we ignore this type of red flags, then this child might suffer any future injury. Okay, so in injury cases, most of the common medical legal situation that homeopath encounter routinely, for example, physical assault, or in cases of road traffic accident, or workplace injury, or sports injury, or fall, etc. So whenever a patient present with an injury, always remember to ask how the injury occurred. Please don't make assumptions, and don't judge anything. And in that case, document everything carefully. Then comes the poisoning cases. Imagine a patient comes with a complaint of vomiting, dizziness, or altered consciousness, and family member says, "We think he has consumed something," and uh, after that, this might be a medical legal concern. We all know that poisoning might be accidental, suicidal, or homicidal. So this might be a life-threatening condition. Then comes the cases of domestic violence. In that, patient may comes with symptoms of anxiety, depression, sleep disorder, chronic pain, and repeated injury. Then cases of the child abuse and cases of sexual assault. This type of cases may present with physical injuries, psychological trauma, anxiety, fear, etc. Then there were cases of suicidal attempts. They may be present after drug overdose, or poison, or self-inflicted injuries. Then cases of burns. So in cases of burns, never assume a cause without proper history. Okay, so now let's discuss some warning sign that should immediately raise our suspicion. For example, when history does not match the injury. There are different versions of the stories are given by different people. There is delay in seeking treatment. There were repeated injuries, fearful or hesitant behavior, unusual injury patterns. So, whenever you encounter these signs, uh, pause for a while and think twice. So, uh, up till now, we have learned how to recognize a medico-legal situation. So now, once we recognize a medico-legal case, then what should we do next? And the answer is we should record the. Okay, record, it means documentation. Okay, if we ask any experienced listener, what is your best defense in medical legal case? Many of them will say it is a good treatment, it is a good clinical knowledge, all of that. Yes, all of these are important, but from a medical legal perspective, uh, this answer is very much simple. That is your records, your documentation, your written evidence. This is a very important topic, important part in medical legal practice. Now, imagine one scenario that a patient visit to your clinic, you examine the patient, you prescribe medicine, you give, explain everything carefully, and then patient leaves. Now, 6 months later, a complaint was filed, and someone asked, "Doctor, can you prove that what happened during that consultation?" Now, what will you do? On your memory, patient memory, or relatives' memory? No, we will only rely on our records, on the documentation. So there is one famous medical legal saying, not documented, it is considered not done. Let me repeat that. If it is not documented, it is considered not done. So documentation is very much important in medical legal practice. Uh, then what should be documented? Let's break this into a practical step. Whenever a patient comes to your clinic, there are certain things recorded. First, we should record the patient identification detail. For example, patient name, age, gender, contact details, date of consultation, and then we should record the we should record the complaints of patient very clearly. For example, a patient comes with complaint of pain. So instead of writing pain, we should write with LSMC. That is, for example, pain in right knee since 3 weeks, and which is aggravated by walking. Okay, this make a difference. Then comes the history part. In history, it is one of the most important documentation. For example, if a patient comes with any injury or so at that time we should write patient has so many injury, not like that, but we should write patient has bruise on her left arm measuring approximately 3 centimeter in diameter. Likewise, then comes the examination findings. This is particularly important in the injury cases. Don't write a vague description like injury patient or patient has severe wound or multiple wounds, etc. Be specific. For example, abrasion measuring approximately 2 by 1 centimeter over the right arm, or bruises measuring 2 or centimeter in diameter over the left upper arm, and likewise. Okay, so always record facts, not the assumption. Okay, then comes the part of diagnosis. So we should record our diagnosis. For example, acute gastritis, migraine, or a suspected case of poisoning, or head injury in the evaluation. Remember, if the diagnosis is uncertain, then say so. There is nothing wrong with documenting uncertainty. Okay. Then comes the treatment part. We should document the treatment which was given by us to the patient. We should document which medicine we are prescribed, potency, doses, and any advice given to the patient. So what happens? Many doctors underestimate the importance of documenting advice. Suppose you advise rest or follow up for 2 to 3 days or an emergency consultation if symptoms is worse, then document it. if it is not written, then it becomes very much difficult to prove it later on. Okay, then comes the referral note. If it is necessary to refer a patient, then we should document it properly. For example, patient is advise immediate referral to the higher center to evaluate a head injury. So simply write these lines. Okay. Okay. Now, okay. So now let's discuss some common mistakes that doctor make while documentation. For example, doctor may write an incomplete note. He might using a vague language, then fail to record advice. He might fail to record referrals, making assumptions instead of recording facts, and altering records later. So, remember, never alter records after the fact, and the correction should always be transparent and properly documented. So here is a simple documentation formula. So whenever you see a patient, always remember HETAR, that is history, examination, treatment, advice, and referral if needed. So if these 5 components are properly documented, your record becomes significantly stronger. Okay. So up till now, we have learned how to recognize a medical legal situation and what should be documented in them. So now let's move further towards our third golden rule of medical legal practice, that is refer. Okay. Uh, Let me begin with a simple question. As a doctor, what is your responsibility? Okay, what is your responsibility? It is to treat any patient who enters to your clinic, or is to ensure that every patient receive most appropriate care. Yes, yes, definitely. Our responsibility is not to prove that we can manage every condition, but our responsibility is to ensure that patients should receive appropriate care. Uh, so uh, Always remember, a good doctor knows how to treat, and a wise doctor knows when not to treat. There is absolutely no shame in referring a patient. In fact, timely referral is often one of the most strongest example of good clinical judgments. Okay, so let me make clear, absolutely clear, that referral is not a failure. Referral is not incompetence. Giving up. Referral is a responsible patient care. So whenever a patient condition exceed your available resources, your expertise, or a scope of management, then referral becomes the safest option. Now let's discuss some common example where we should refer a patient to a higher center. For example, in cases of the head injury, if a patient present with loss of consciousness, vomiting, drowsiness, confusion, or seizures, okay, then in this situation, patient requires urgent referrals. Okay, then cases of suspected stroke. Suppose a patient is suddenly developing slurred speech, weakness of one side of the body, facial deviation, difficulty in speaking. Then immediate referral is essential in this case. Then suppose patient is come with the complaint of chest pain, sweating, breathlessness, and radiating pain to the arm or jaw. So we should know that this is not a situation for observation in clinic. It is an urgent emergency and reference is required. Then in cases of the poisoning, suppose patient is come with the uh, ingesting some pesticide or some chemicals or some drug overdose. In such cases, reference is very much essential, because a delay in referring can hamper the patient life. Then cases of the severe trauma like road traffic accident, deep wound, fractures, or severe bleedings. Okay, and in cases of sexual assault cases, okay, these are the cases who require a sensitive handling, proper medical legal procedures, and it requires special examination, though they are uh, referred to and higher and appropriate centers. Then in unconscious person, we should refer the patient to the higher center. So don't delay, don't wait, and do not assume. Just refer them. Okay. Now, what if the patient refuses a referral? What should we do at that situation? Now, this situation is very common. Suppose we explain all the things to the patient, and patient says, "Doctor, I don't want to go," or "I will go tomorrow," or "I trust only you." Then, what should you do in this situation? So, whenever this situation occurs, first explain the seriousness of the condition to the patient, explain possible risk, explain potential consequences of delaying in treatment. Then the second most important thing, document everything you discussed. Okay, documentation is very important. So for example, urgent referral advice, risk explained to the patient and patient decline referral at present. So simply if patient is declining, then you have to write this uh, in your case paper. Okay, and during this reference, communication is a very important thing. So whenever possible, just try to record the communication if possible. So here are some common referral mistakes. So let's discuss that. There is delaying in referral despite of warning sign. There might be a failing to explain the urgency, not documenting referral advice, assuming that the patient understood everything that we explained to them, and continuing treatment beyond one's capacity. Okay. So these mistakes can have serious clinical and medical legal consequences. Okay. Uh, okay. So up till now we have discussed about the RRR framework, that is recognize, record, and refer. Now let's move to the another area that is often underestimated by the doctors, and that is the responsible for large number of medical legal disputes, and this area is communication and informed consent. Many of times patients don't complain because they didn't get a desired outcome, but because sometimes they complain because they felt ignored, they felt unheard, they felt disrespected, or they felt misinformed, or in other words we can say many medical legal problem begins with poor communication. Okay. We have so many patients that uh, say us that doctor, nobody explained this to me, or they say I didn't know this could be, might be happen, or if I had known this earlier I would have done something different. So these are the statements are very common in recent scenarios. Okay. So here there is one issue, that is lack of communication. Now let's discuss one of the most important medical legal concept, that is informed consent. So many people think that consent are simply taking signature on a form, but this is not correct. Signature alone is not equal to informed consent. So informed consent is a process, it's a conversation. So it is a shared decision making between doctor and patient. So there are three essential components of informed consent, that is information, understanding, and agreement. Information must so patient must receive the relevant information from doctor, and patient must understand that information, and agreement, the patient must voluntarily agree to that information. Then and then we can say that consent is truly informed. Then what information should be said in the consent? So we should say what is problem, what is the treatment is being processed, what are the expected benefits, what are the possible risks, what are the alternatives available, and what may happen if treatment is delayed or refused. Okay. Uh, Okay, many of us think that consent is only associated with the surgeries, but it's not like that. Consent is relevant in everyday clinical practice. For example, in cases of teleconsultation, for the photography, if you want to take for any educational purposes, for sharing patient information on social media platform or anywhere, for clinical procedures, and for making referral decisions. Here, remember, the principle remains the same, that is, patients should understand what is being done and why. Okay. So, now that we have discussed the communication and informed consent, so now let's move to another area that is being more important in today's modern healthcare, that is telemedicine and WhatsApp consultation and social media, artificial intelligence. Okay. So today's doctors are not only practicing in their clinics, but they are also practicing in this digital world. And this digital world brings new medical legal challenges. Okay, nowadays patient can contact doctors through WhatsApp, through video calls, or through social media, or emails, or any telemedicine platforms, or using AI tools, etc., etc. Yes, technology has made healthcare more accessible, but it has also created some new medical legal responsibilities. And many doctors unknowingly place themselves at a risk because they are unaware of these legal challenges. So many of us, rather all of us, have received the messages like, "Doctor, can you suggest the medicine? Doctor, please look at this photograph and tell me what is this. Doctor K, I can't visit your clinic today. Send me some prescription on WhatsApp." Okay, these are the this become a routine part of our modern practice. So let's consider a common scenario. Suppose a patient send you a message and says, "Doctor, I have a severe headache. What medicine should I take?" Suppose you are busy and you quickly reply with medicine suggestions that take this is medicine. And by the next day, you learn that the patient is actually developing a stroke. Now, in this situation, ask yourself, did you have enough information? Did you have do proper assessment? Did you document the interaction between you and patient? Did you advise an emergency evaluation? Okay, this is the example that any casual medical advice can be risky. So think twice. Uh, then one more question is that what documentation should be make while doing consultation online? So we are doing documentation in our clinics very carefully when patient visit our clinic, but we often forget to document the teleconsultation, and this is the biggest mistake. So in teleconsultation, we should record the date and time, patient details, complaints, and what advice we give to the patient, and follow up recommendation and any referral advice. Always remember that teleconsultation should leave a professional record just like an in-person consultation. Okay. So if we are doing online consultation, then we should document each and everything like in-patient records. Okay, just remember that. Okay, so now let's discuss another important area, that is social media. We have so much social media platforms like Instagram, Facebook, YouTube, Twitter, LinkedIn, etc., etc. And these are the platforms that doctors are using nowadays, and they allow us to educate public. They are very much important to share knowledge with the public, to build professional visibility and promote health awareness. Okay, these are the positive developments, but social media also creates medical legal risk. For example, imagine one doctor post on social media with photograph of the patient, like before and after, and they write in the caption, "Look at this amazing patient improvement." Okay, here the intention of doctor is only to educate the people or on any educational purpose. But here is one important question: is that uh, was the consent of patient is obtained? uh, is confidentiality is maintained or not? Okay, so here there are many questions related question confidentiality in this type of the situations. So there are some social media pitfalls. Okay, when we share any testimonials or we claim any exaggerate situations, for example, a guaranteed cure or 100% cure or 100% success in so and so cases or a permanent cure. Okay, so likewise. Uh, Now let's discuss one of the most exciting development in healthcare, that is AI, artificial intelligence. So nowadays many doctors use AI tools for preparation of clinical notes, for developing educational content, for summarizing information, for differential diagnosis, and even for drafting documents. Uh, Yes, definitely. AI can save time. AI can improve the efficacy. AI can support learning. But there is an important principle that every doctor should remember, that AI is only a tool. It is not a doctor. Okay. So AI only can assist. It cannot replace the professional judgment. Now, imagine you are using AI to generate a diagnosis, a prescription, and a referral decision without any verification. Then what happens if AI makes a mistake? Then who is responsible? Yes, answer is very much simple. That is, doctor is responsible, not the software, not the application, not the algorithm, but only the doctor is responsible. So whenever you use AI, just verify before you trust any information. Okay. Okay. Uh, so now let's discuss some common errors or some common digital mistakes made by doctors. Uh, Providing detailed medical advice without adequate assessment. Sometimes fail to document teleconsultations, then sharing patient information without consent on social medias, and then making unrealistic treatment claims, like before and after photographs and 100% result and all that, then blindly trusting AI generated information without verification, and treating the social media conversation as casual rather than the professional interaction. So, avoiding this mistake can significantly reduce medical legal risk. Okay. So here is a simple digital safety framework. So whenever you use a technology in healthcare, always remember PPDV framework. What is PPDV framework? That is privacy, professionalism, documentation, and verification. Privacy, always protect your patient confidentiality, maintain professional standards, and document everything, even your conversation and communication if possible, and verify the information before acting on it. It is PPDV framework. Okay, so up till now we have discussed about RRR framework, that is recognize, record, and refer. Then we discuss about the communication and consent part, and we also discussed the digital medical legal challenges. Now let's bring this everything together through a real world examples, because medical legal competence is not learned from the definition alone. it is learned through the practical situation. So in daily practice, patients do not arrive with labels such as I'm a medical legal case. They arrive with symptoms. And our job is to recognize the hidden medical legal implications. So let's do some exercise. Here I'm sharing some example of cases. For each case, ask yourself, is this a medical legal case? What should I document? Should I refer this patient or not? And what are my professional responsibilities? And also remember that RRR framework. Okay. So let's do this exercise. Here is the first case. The case of 45-year-old man that visits your clinic with the complaint of headache, vomiting, dizziness. So when you ask about the history, he says, Doctor, I slept in the bathroom this morning, and on examination, you find mild scalp swelling, slight drowsiness, and a slow response to question. Now, what will you do in this situation? Yes, anybody? What will you do? Anybody? Refer, okay. Ask for admission. Okay, so first we have to recognize, is this a case is medical legal or not? So if we see the history, there is a history of falling. There is the history of injury. So this is a potential medical legal case. Okay, this is not a routine case. And there is drowsiness. So these are the red flags in history. So first, we have recognized the case that this is a medical legal case. Then comes the record portion, documentation. We should record all the things, and we should refer this patient to the uh, higher center. Okay. Okay. Then let's. Mhm. Okay. Uh, okay. Is it visible? Okay.
This is everything fine.
Okay, okay. Now let's take example of 32-year-old woman comes to our clinic with complaint of anxiety, poor sleep, and frequent headache. Then when you examine, you notice bruises on her forearm, and you gently ask about them to her, and she awards eye contact with you and says, "Doctor, it's nothing." Now, what will you do in this case?
It can be due to some quarrel or sometimes torturing by the family members or others. So there
Yes,
also
yes,
medical legal question comes in, but you will have to interact with the patient and
yes. We are.
make it a good interaction.
Yes, then what will you document in this case?
So only after finding what she tell, and we can assess what she is mentioning. And if you find that there is something wrong with her, definitely you can uh, call the police, or you can inform the police.
Yes, yes, exactly. Exactly. This might be, but we are not sure, but this might be a case of domestic violence. And if that's so, we should treat it accordingly, or we should send it to the higher center. And for the documentation purpose, we should document each and every injury in detail. Okay. And if necessary, then we can refer this patient. Okay. And now let's discuss another case. For example, a 7-year-old child is brought by parents to your clinic, and parent says, "Doctor, he falls frequently while praying." And while examination, you notice multiple bruises, and there were injuries of different ages. Uh, there were unusual injury locations. then in this scenario, what will you do?
The same thing can be done. We can, of course, give some medicine to the patient, but as we used to say, we can give arnica or something like that. But in between, you can send, you can call the child health organization or somebody like that.
Yes, yes, that might be a possible case of child abuse. We never know, but we should uh, document that all the injuries very carefully in context of number of injuries or location, size, of appearance, and if abuse is suspected, then refer to the patient to the higher centers or take the proper steps. Okay, then let's discuss another case. Suppose a young man is brought to your clinic with a complaint of vomiting, sweating, drowsiness, etc. And the family member says you that we think he consumes some pesticides. Okay, so in this case scenario, what will you do?
We can refer to higher centers. That's what the best thing.
Okay, from history, there is a consumption of pesticides. So this is a potential medical legal case. Okay, so in that situation, we should record all the history, and if we know the substance, then we should record it, time of exposure and clinical findings, and then we have to refer it to the higher centers or an emergency care. Meanwhile, if we want to give any primary treatment, then we should also record that treatment details with the referral notes. Okay. So now let's take one another example. That, for example, suppose patient send you a WhatsApp message at 11:30 p.m. Says, "Doctor, I have severe chest pain. What medicine should I take?" You never examine this patient. Now, this is the scenario, and what will you do at this time? Should you simply recommend a medicine, or you do reference, or what will you do?
It is
Yes, anybody?
better to direct him the higher of centers.
Yes, yes, this might be a potential emergency that the chest pain is that might be represent a cardiac arrest or heart attack. So we should first record all the communication between doctor and patient, and immediately we should advise this patient to a higher center for the evaluation. So for the patient safety. Okay, so that was all about today's webinar. So as we conclude today's webinar, so let's remember that every consultation has a potential to become a medical legal event. The difference often depends not on the disease itself, but how the doctor respond to it. By applying the principles that we have discussed today, we can become not only a better clinician but also a safer and more confident professional. So here is a message for everyone, that practice as if your records may be read in the courtroom one day. Medical legal awareness is professionalism, not fear. It protects the patient, the doctor, and the profession. And always remember that RRR framework, that is recognize the medical legal case, record every detail, and refer promptly when needed. Okay, then that's all for today's webinar. Thank you so much.
Thank you, Dr.
And
Janaki Bhavandia. It was
there
really an excellent session,
any
and
questions?
yes, we really appreciate you
Thank
for
you.
the beautiful session, and you really highlighted what are the things to be
Uh,
and what are the things not to be done while practicing. That are the immediate consequences. What Anyway, with us another doctor advocate, that is none other than Dr. Indrani Bhavarkar. He's from Mumbai and he's about to, he's practicing advocate as well as practicing homeopathy also. So I'm inviting sir to this session. You can
Yeah,
have some.
thank you. Thank you, sir. Firstly, I will congratulate Madam Janki. She has presented in a very nice and easy way of medical legal things to us. So we are very happy about the inputs. Madam Janki, about record keeping, just as a part of the inquiry, can you tell us that in the records, how many years the records patient should keep with them in different cases? Do you have it with you? Or like how should they keep? Because this is a common place where in consumer courts or the civil courts, the doctor fails because he cannot produce the record. And once the record is not produced, the doctor loses the case. So can you guide for that?
Sir, for that, so doctor has their record set in which details are mentioned about each and everything with even follow-ups. So in that set, we should write from starting from the we can say that primary details to the to the diagnosis. In history portion, we should mention all of minute details. For example, if the case
Sorry,
was of
sorry to interrupt you. My question is, suppose a doctor goes in a court and
yeah.
he could not produce a record.
Hmm.
Okay. So how many years is the binding for a doctor to keep the record with him? Do you have some years with you? Because this is a
Uh,
common question for doctors.
yes. Well, there is a guideline to maintain minimum 5 years of records with us, and if we are discarding the old records older than 5 years, then we should also requested to keep that record. That how we can discard this that all of that. So all doctors are requested to keep records of last 5 years, minimum of 5 years.
With your permission, in 2, 3 lines, can I mention the record years with your permission?
Yeah, yes, sir, definitely.
Okay, very thankful for that. So, friends, the records from medical legal point of view is very important. Basically, in general OPD cases, we have to mention the record only for 3 years. And if the
Okay.
patient asks you the records before 3 years, or even if the police ask you, you can deny that. 3 years is the
Yes,
limit. In surgical cases, in obstetric cases, in pediatric cases, 7 years we should keep the record with us. That is mandatory.
yes.
Minimum 7 years. In case of emergencies, like you said, referring cases, or in case of trauma cases, for that also 7 years. Medical legal cases, suppose we are sued in a court as a
Mm,
doctor,
mm.
and court finds that we should maintain these records for 10 years. That is very important. It's not a small time. And we should go and keep these records in our locker. They should not go here and there in the OPD because anytime court may ask us.
Yes,
And a
definitely.
small consent form, when you explained very nice about informed consent. But after taking the consent, the patient gets referred, the form goes here and there.
Network problem here again. Yes.
Yeah. So like this, the record keeping is a very big lecture, but very nice. I think this should be good guidelines to all of our doctors. But you highlighted very nice points. We are very happy about your explanation. Somebody else can also proceed with their questions. No problem. Yeah.
Yes. Now I'm inviting Professor Pandey sir.
Thank you, sir. Dr. Janki is Associate Professor in the Department of Forensic Medicine and Toxicology in our college. That's why she presented the unique presentation about the medical legal importance for homeopathic doctors. And as Indranil sir told, those hospitals are NABH accredited. There is an MRD room there. So in MRD section, it has been clearly mentioned what sir has clearly told. Minimum 7 years, as per my knowledge, is concerned, and 3 years. 3 years is compulsory, and that should be identified properly and should be kept in the record record room with sincerely with confidentially, because any time the police may ask about this whenever it is needed. And irrespective of homeopathic, allopathy, whatever may be the doctor, if you have been appointed any PSC, CSC, and any medical legal case will come to your jurisdiction, you are supposed to be witness. So this knowledge is essential. Even the poisoning cases, whatever you have referred, everything must be there. Of course, every doctor, in case of heart problem, should know the CPR by which the patient can be survived. After that, he can refer the case. But the emergency case must be referred. It is suggested in NABH also. Second thing, here Janki was mentioned everything about the physical injury. I would like to request Janki madam, what is the medical legal importance of mental injuries, and how should they be evaluated and managed?
Oh, in that case, sir, we should investigate properly, because at first scenario, in first consultation, in that mental injury, it might be of domestic violence or any torture or mental torturing. The patient doesn't admit it at a very first meeting. So, in that case, we should investigate thoroughly, and we should maintain proper rapport with the patient. And if we find some that red flags in history, then we should counsel the patient to take appropriate steps towards them.
So, as homeopathy, Dr. Hahnemann has mentioned these cases are comes under obvious causes. So, in case of obvious causes, you have to take the confidence of the patient, and keen observation is required. And we are not the investigator, as you told. So, after recording, we have to send the patient to higher center. Again, in domestic, in mental injury cases, and another thing, there is a mental disease mentioned in organ of medicine. Wherever necessary, we can take the help of that mental disease management, as Hahnemann has mentioned, between 210 to 230 aphorism. Thank you very much.
Okay, sir. And now I am inviting Dr. Abraham Vaidyan to say a word of thanks. Dr. Abraham Vaidyan, you can say something and then we can. Dr. Abraham Vaidyan, you can say a word of thanks to the session.
Hello,
Yes.
Doctor.
Yes.
Dr. Janaki. It was a wonderful session.
Thank you, sir.
It was really an eye opener for us. I had practicing for more than 40 years, but I am not aware of these facts. So thank you very much. And I asked another question in chat box, that if the doctor is working in an institution, he transferred from there, then who is responsible to keep the case records? That's my question. If you work in a government or in a private sector, usually the records are kept with the institution. Then how the doctor can produce the cases if an inquiry develops? That's my question.
Sorry, sir, can you repeat that? I can't understand what you said.
If the doctor is working in an institution, usually the records are kept in that institution. Then the doctor transfer from there. Then who is responsible to keep that records? If anything arises, who is answer? That's my question.
I think I'm not sure, but it is the responsibility of that institute or
Yes,
that
exactly.
other one for keeping the record on
Yes.
this. I think Dr. Indranil can
Dr.
guide
Indra-
us on this.
Yes, Dr. Indranil, you can tell.
Yeah, sure. Madam, can you again narrate me the sir's question? I was on another call in 1 or 2 lines.
Sir, no time, sir. This time is already over, sir.
Okay, 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 okay.
We are.
Okay.
You
Actually,
can say.
I have not heard, sir. I'm sorry about that. I was on
The
another
question
call.
is that if a doctor is working in an institution and who is responsible for keeping the files there?
I'll tell you. The institute is responsible because this comes under vicarious responsibility. And the doctor is there. Sometimes he may leave the job and go, but the responsibility of the institute. So it never lies upon the doctor. Only he is acting on the part of the institute. So 100% the institute is responsible for all these things to be kept properly.
Okay.
Thank you very much, sir. Thank you very much.
Okay,
Yeah.
thank you, Dr. Abraham Maidin, Dr. Indrani Bhavkar, Dr. Vipul Kumar Pandey sir, and our guest faculty, Dr. Janaki Bhavkar.
Thank you so much.
With that, we come to the end of this day. Thank you all for joining the session. Tomorrow, we will have a session from Dr. Mrs. Pallavi Patil. She is the professor of Homeopathic Medica House. Homeopathic Medical College Hospital, Mysore, Kolhapur, Maharashtra. And the topic will be effectiveness of Dementia Silvestre in homeopathic management of type 2 diabetes, a pilot randomized control trial. Thank you all. Good night.
Thank you.
Over to Dr. Mariamma John to moderate the Malayalam session.
The next doctor.